Um, Good afternoon and welcome to Council's 5th Town Hall on Reimagining Public Safety. As a part of Council's Reimagining Safety initiative, we're holding a total of 6 town halls to hear from national experts and residents. These town halls, in addition to focus groups and a community survey, will help inform Council as we finalize and consider the city's annual operating budget in February. Tonight, we'll be talking about investing in violence prevention. This topic was explored earlier this month by Council President Shannon Hardin in his hearing, and we are continuing to dive in today. Or no, I'm sorry, it wasn't Councilmember Hardin. He did the response, crisis response one. I think this one is the first of it, and there will be another. We are joined by 2 expert presenters on the topic. Edward Johnson, Director of Public Health Policy at Columbus Public Health. He will present on the VOICE program. And Reverend Paul Abernathy is here with us too. He's joining us from Pittsburgh to present on his work on the Neighborhood Resiliency Project in Pittsburgh. We'll hear a short presentation from our guests, and after that, council members who are present will ask questions, really develop a comprehensive look at reimagining public safety. Saunders Company will lead the audience through an engagement activity to help get your feedback. And then at the end, we'll hear public testimony. But in addition to our conversation about violence prevention, we're actually going to start up top by receiving a short presentation from Assistant City Attorney Jeff Furby on Andre's Law, which Council will vote on this coming Monday. I also want to mention that I'm currently at home with a 1-month-old on maternity leave, such as it is. So I apologize ahead of time that it's very likely I may not be on for the entire town hall. There might be baby noises. She's currently eating. And so bear with me on maybe a tiny bit of chaos in my end. I'm grateful to President Hardin for being here to close things out if necessary because of my situation. And I do want to highlight my colleagues for being here tonight, not just Council President Hardin, but Council Member Shayla Favor as well. Thank you so much for your participation in this topic, in this hearing. I will have the opportunity to review the recording and any public testimony that I missed too, just so everyone's aware. You can do that as well on YouTube. So before turning things over to our presenters, I just want to lay out some aspirational goals as we talk about violence prevention. We aim to promote the safety of every resident in Columbus. We have to do more than simply respond to violence when it occurs, if we are to achieve that. And that means looking at the root causes of violence on the front end and focusing our resources to address basic needs. The goal is to build more stable and resilient neighborhoods. And while it's aspirational, I'm very optimistic about this project because we know that when we invest in communities, we can build resilient neighborhoods. We know that part of preventing violence is also the presence of resources. And so that is what Council pledges to bring to this effort in examining how we can do more targeted efforts to prevent violence, but also our overarching goal in the budget, and I say this as finance chair, is to do more to encourage the presence of resources in neighborhoods, stable housing, access to quality education. All of these things feed into safe communities for all of our residents. Today, we're drilling down really specifically on violence prevention and intervention that we know can be successful right here in our city and that we've seen to be successful in other cities as well. So with that, I'll turn the floor over to Jeff Furby to present an overview of Andre's Law. Although Andre's Law is not directly related to the rest of tonight's subject matter, it's an important piece of legislation that we'll consider on Monday, and we wanted to take the time to review the proposal. It's in response to the tragic shooting and death of Andre Hill by a Columbus police officer, and as is clear, is named in his honor. First proposed by Mr. Hill's own family, the law increases transparency by increasing the required use of body cameras and also addresses the need for officers to render aid to those whom they've injured. First aid can mean the difference between life and death, and our officers must always strive to preserve life. So with that, Mr. Furby, would you please provide an overview of the legislation? Oh, no. Oh, here we go. Mr. Furby, you are on mute.
Oh,
there you go. Now we can hear you.
Okay, am I there?
Yep.
Okay. Andre's Law will enact new chapters to the City Code, chapters 1914 and 1915, and as indicated, they will require, one, the activation of body cameras, and two, the rendering of aid. Chapter 1914 will require activation of body cameras during any enforcement action, which I'll explain in a moment. And Chapter 1915 really has two parts, in that it will require police officers to summons aid immediately for anyone whom they've injured, whom they've caused seriously bodily harm to through the use of force. And it also will require an officer to render aid to such a person. And finally, it will require the Division of Police to train those officers to do those things. So Chapter 1914, body-worn cameras, will require officers to activate their body cameras when they engage or intend to engage in enforcement action. They'll have to activate their body cameras no later than when they exit their cruiser or approach an individual. The goal of this section will be that all enforcement actions are captured on body-worn cameras. Enforcement actions are defined in Chapter 1914. They include calls for service, all stops, pursuits, uses of force, arrests, home entries. So it captures really all police activity to be captured on body cameras. Obviously, with the goal to be that everything that happens is preserved by video and audio and body cameras. There are some exceptions. This section will not apply if an officer is not assigned a body camera, and there are those who are not. Those are all outside of patrol, so it's unlikely their issue. It also would not apply if something malfunctioned with their body camera. But the goal is for enforcement actions to be captured on body camera. Flipping over to Chapter 1915, rendering aid. This chapter will require police officers following the use of force that causes seriously bodily harm to an individual to immediately summons emergency medical services, or to cause it to be summoned. So medics are en route right away, immediately upon the use of force, to aid that person who's injured. Medical aid must also be rendered by one or more division officers, at a minimum one division officer, to an individual who is suffering serious bodily injury due to the use of force. This medical aid must be rendered consistent with the medical equipment available and or the training the officer has received. The officer must render that treatment and basically until and can cease when a medic arrives. The Division of Police shall also require training for officers on CPR and basic medical aid, and shall require retraining for those officers over time, so those officers are always in a position to render that needed aid to a citizen to whom they cause seriously bodily harm. Finally, officers may be disciplined if they do not render this aid, and if they do not turn on their body cameras, pursuant to division directives. And Columbus Police have already started adopting directives consistent with these code sections, so they will be enforced through division policy as well. Thank you. Have a nice evening.
Thank you so much, Mr. Furby. I want to pause to see if my colleagues, Councilmember Emmanuel Remy and Councilmember Rob Dorans are also on. I want to take a moment to see if my colleagues have any questions, and also give Council President Hardin a chance to offer any additional thoughts. Council President Hardin introduced the ordinance on Monday, and so I just want to open it up briefly for questions or thoughts from my colleagues.
Thank you, President Pro Tem, and thank you to Mr. Furby. You know, this is a step in the right direction. We all have mourned with the Hill family for the circumstances that caused his death. And we think that this piece of legislation, and I should pause here to thank all of our council colleagues. A lot of council members weighed in to make the original piece of legislation better, and the administration, Mr. Furby as well, made this legislation better. But what we are hoping with this legislation is that never again will a victim have to lay without aid being rendered to them from our Columbus police. And if so, that there would be on the books a law. And we have to remember that this has already been it was a policy that the police chief put into place after Mr. Hill's death, but now this will be codified into law with very specific ramifications if our officers don't, as President Pro Tem said, preserve life, because that should be our top priority. So I just want to thank the administration, but also thank my colleagues. I know a lot of my colleagues weighed in to make this legislation better. So with that, I'll turn it back over to you, President.
Thank you, Council President. And I appreciate the way that all of council and the staff teams worked quickly to get Andre's Law put together. I do not think that this is not the last piece of reform that we are doing, and but it was a piece extremely important to get urgently correct. So thank you, Council President, for your leadership. Are there other questions or comments from my colleagues? Okay.
No, I will. Thank you, Councilmember Brown. I just want to underscore, the point that you just made, that this is not the end of, the efforts around reform, because ultimately we want to make sure that, an individual is never in that situation in Columbus ever again. And so this goes beyond, the decency of providing aid when someone is in need of that aid. Or using a camera because the city has purchased those cameras, and with the intent that you use those cameras. But we want to ensure that the situation that made this unfortunate incident possible never occurs again. So we're talking about whether we're talking about training, or we're talking about cultural competencies, whatever we need to do to continue to elevate this conversation. I'm willing to be a willing participant in that. I do want to thank everyone at council who worked very swiftly to bring this to fruition. I once again, want to elevate the Hill family. And even in the midst of their grief, having the wherewithal to still fight for justice and put equitable solutions on the table, so that another family in Columbus doesn't have to grieve like this. So I just want to continue to lift them up in our thoughts and prayers at this time.
Thank you. Are there anything else? Great. Well, thank you, Mr. Furby, for that overview, and to my colleagues. We're going to move on to the violence prevention topic. So next we have Edward Johnson here with us. As I mentioned at the top of the program, he's going to provide an overview of the Voices program, which is a really critical violence prevention work that's done at Columbus Public Health. So Mr. Johnson, the floor is yours.
Thank you, President Pro Tem Brown, President Harden, Council Members Dorans, Favor, Remy, and the baby can stay. I really don't mind the sounds of kids. But thanks for the opportunity to be here to talk about something other than the major public health pressing issue of the day, to talk about our violence outreach, intervention, and community engagement Voices program on behalf of our Health Commissioner, Dr. Mashika Roberts. I'm sure as many of you know, for about 3 years, Columbus Public Health has hosted the Violent Crime Review Group, VCRG, which is part of the Mayor's comprehensive neighborhood safety strategy. The VCRG facilitates a process to mobilize several city agencies when there's a homicide in one of our focus areas, Linden, Southside, and the Hilltop. Throughout that time, we've observed that interpersonal violence is a really complex and multifaceted issue, and I think that's an understatement to say the least. But what we have observed as we're going through much of this data is that those involved in violent crimes are apt to continue their involvement unless there's fundamental change in their personal lives. For many, that positive and lasting change is difficult without the ability to successfully address issues with life skills and stability, mental health, the judicial system, educational or vocational deficiencies as well. Our community has many assets to assist individuals, but what we've observed is the mere presence of organizations that provide that help may not be sufficient to guarantee usage or meaningful outcomes. And so we took some time to study two models before bringing the Voices program here to Columbus. The first was San Francisco General Hospital's The Wraparound Project, begun in 2015, which over the course of its life has reduced re-injury rates due to violent crimes by 50% with its participants. And then we also studied Oakland's Oakland Unite Highland Hospital partnership, which was able to have recidivism rates for its participants, which I believe was begun early in the 20-teens. What we're proposing to do with this program is to link with Grant Medical Center's emergency department to link trauma patients injured in violent crimes, which we're classifying as gunshots, stabbings, and assaults, while excluding self-harm and domestic incidents. The clients that we'll be serving will be between the ages of 18 and 40 from 4 zip codes, 2 of which are in our VCRG areas, and 2 of which are not, but we've observed are experiencing high rates of violent crimes. Those zip codes are 43203, the Bronzeville neighborhood, 43206, South Side, 43207, far South Side, and 43227, that mid-east area of our city. What we'll do with the program is we'll have an outreach worker that will be with the Department of Recreation and Parks APPS program, and a social worker with Columbus Public Health Care Coalition that will work with patients who accept entry into the program to create management plans that will look at behavior and mental health counseling, that will look at educational and vocational development, and housing and legal assistance. And with a generous gift from the Ohio Health Foundation, we're also going to look at offering incentives to encourage folks to stay within this program over the course of 12 months. And so what our social workers and what our outreach worker will be doing is they'll be tracking for program participation and linkages. They'll be studying for rearrest rates and re-injury rates. We chose the zip codes that we did. Like I said, there were elevated levels over 2019 that were experienced at Grant Medical Center's ED. So this may not capture all of the incidents that occurred because individuals may have been routed to other areas, but that information was what was provided to us from our partners at Grant Medical Center. Over the course of 1 year, we're setting aside $2,000 per participant. That would not be given out all at once. It would be meted out at regular intervals for hitting certain participation milestones over the course of the program. And so what will end up happening is it really depends on the participant and the assessment that the social worker performs, whether there needs to be weekly or bi-weekly or a monthly check-in probably at the latest, and then how that incentive structure will be structured as well. It was anticipated tentatively to start in January. However, for obvious reasons, there have been limitations around what we've been able to stand up, but we are hoping to start it later this year, potentially in Q2. With that, we've proposed 2 full-time staff, a new outreach worker at Recreation Parks and a new social worker here at Columbus Public Health to stand up this pilot program. And if it's successful, we would obviously hope to expand it to serve more clients and potentially more areas. With that, I'll turn it back to you, Chair Brown, to see if there are any questions, comments, or concerns.
I will start with one and then pass it to my colleagues. Can you speak a little more what the relationship will be like between the social workers and the medical staff at Grant, or if there is an ongoing relationship, or how that seems to me the more they can work together, the better the outcomes?
Absolutely. So the medical staff at the emergency department will be in contact with our social worker. So they'll be able to identify an individual that they say, hey, this individual fits the criteria. Whether they've seen them before or not in the emergency department, I think will be a factor as well. But just having that relationship, it has been envisioned that the social worker would be stationed at Grant Medical Center for a number of hours in the week based on demand and how that's fluctuating throughout the year. So there may be times where the social worker is not there on first shift, but maybe they're on the back half of first shift and the second half or the first half of second shift. So that they're there, they're available, and they can come to the room or come to the bedside if the medical professional says this person's probably most receptive at this moment to being in this program.
Thank you. Are there questions from my colleagues?
Thank you, Councilmember Brown. Thank you, Edward, for being here today. I'm really excited about this program. I may have missed it, but how many participants will be in the pilot program?
Councilmember, you did not miss it because I forgot to say it. There will be 20 clients, a maximum of 20 clients. That's how much funding we've received from the Ohio Health Foundation, and that's how many the social worker feels they can manage at one time.
Okay. And you stated that there would be $2,000 allotted for each individual that completes the pilot program?
Yes, ma'am.
Okay. So I imagine that the treatment plans are obviously going to be different for each individual. So will any of those costs that could arise from those extra treatments, if you will, is that what that $2,000 will help cover, or is that part of the incentive for the individual to participate in the program?
I think the $2,000 is purely the incentive portion of it. I will take a look at the budget again, but I do believe we had some money set aside to encourage transportation or getting to certain appointments to assist with participation in the program. So we wanted to make sure that the incentive structure was preserved.
Okay. Yeah, just wanted to make sure that we're taking into account that there could be some financial obstacles for people that would prevent them from completing the program. And then lastly, could you talk a little bit about what the diversity of the medical and vocational professionals will look like in the pilot program?
At this time, I do not have that information with me. I think it just depends on what the needs of the individual are. So I know that our Care Coalition is usually plugged into a variety of agencies around the city. I think it's just going to depend on who's coming in and what that individual's specific needs are.
Okay. And, asking, given the fact that this is a program that's dealing with individuals who have experienced violence, and just recognizing that people may feel comfortable with, certain types of people, and us being amenable to that fact on the ground. So thank you, Edward, for your presentation tonight.
Thank you, Councilmember.
Council President.
Thank you, Madam Chair. Mr. Johnson, so I say this often. I'm always encouraged by the great work that we're doing. We have great programming out there, and so that's an aside, or not an aside. But what I'm sometimes concerned with is that our good work does not connect with each other and create like systems of product. And so we have some of the work that's going on this wholly in police around crisis response. We have apps work, and then we have health-based community intervention work. How do you see the cross connection between departments, between between the different functions that if you take a step back all serve people who are hurting or in need, and is a form of violence prevention? Have you been a part of conversations around cross-department, cross-agency connections and coordination? And could you just speak a little bit about that and your views on how we can strengthen that if you think that's necessary?
Absolutely. Thank you for the question, President Harden. I had mentioned that the Voices program is an outgrowth of the Violent Crime Review Group. This group, I want to say, brings together 8 city agencies, as vast and varied as police, public safety, development, recreation and parks, Columbus Public Health, trying to take the clinical approach to essentially homicides in our target neighborhoods. I think that we've established a very good basis to create more of that collaboration amongst that group. Obviously, when I think it was first started, we all had to figure out what each other was doing, this was not a group that's traditionally brought together when there's a homicide in our city. And so there were initial steps of why are we here? What are we talking about? Other than police delivering, a report of what had just initially happened within the past 24 hours of us convening. As we've come together, and unfortunately, due to the pandemic, it's not as easy for us to come together. We're doing this virtually, and it's hampered a little bit of the work. I think that we've all seen the value in it. Police really value the work of Care Coalition as they're doing community canvases around the incident. So our social workers were going to doors, knocking on the doors with a neighbor and saying, I know that this incident didn't involve you, but something bad really happened. Do you need to talk to someone? Is this a value? And some people would say, no, I'm not prepared for that. But other people would say, I've never had someone check in. And so police started seeing that value. And part of what they said is not just for the incident itself, but for the community, for that block of that neighborhood, we need to make sure this is a safe area to get those social workers out there immediately, as soon as we possibly can. And so I think having those groups come together is a very good basis for cross-departmental consideration of violent crime in our city.
Thank you. That's a really key point too, Council President. Thank you for raising that up. So I want to move along now to our guest. Father Paul Abernathy is here with us today to discuss his work with the Neighborhood Resiliency Project. And I mentioned at top that he is joining us from Pittsburgh. So thank you so much for taking time out to do that virtually to help a nearby city learn about your work. Helping residents meet their basic needs is closely linked with building safe and resilient neighborhoods. And one of those basic needs, especially in neighborhoods that have historically experienced high levels of violence, is to heal from the trauma caused by these tragic events. Living in a neighborhood ravaged by violence takes a toll on those who live there. And we can't ignore that trauma, or we won't be successful in our overall efforts. So making sure that people are healthy enough mentally and physically to take care of themselves and their neighbors is a really crucial step. Father Abernathy is pioneering this work in the Hill District of Pittsburgh. And that is why we are so pleased to have him with us here today. So with no further ado, Father Abernathy, it's great to meet you virtually. And I'm a really big fan of your work, and the floor is yours.
Councilmember Brown, honorable council members, it's an honor for me to be with you. And for the good people of Columbus, I have a deep love for your city. You've always been very gracious to me, and I'm grateful for the time we get to spend together. I also am fans of yours as well. Certainly this issue of violence, many of our communities are suffering from this immense violence. The number of mostly young men who have been killed as a result of gun violence, absolutely unacceptable. And yet, as we talk about dealing with violence in our community, we mustn't lose sight of really these root causes of violence and understanding that really, yes, we must be about the work of interrupting this violence. We must be about the work of implementing strategies and initiatives in our community that really get at this violence when it happens. But we also have to understand that there are certainly these much deeper historical challenges that feed this violence in our communities. They're not only personal, they are communal, they are collective. And so really taking a moment and pausing on the impact that trauma has and how it fuels violence in our community, and then what as a community are we to do about this is extremely important whenever we're talking about this issue of community violence. I mean, many of us at this point are familiar with trauma. It's become a word that I think in many ways is a buzzword in our society. This idea that there is an event or a series of events that threatens us in some way, physically, emotionally, mentally, threatening event or events that happen that we experience. It's important, however, to understand that it's not only the personal experience of trauma. We know that there is absolutely a correlation between trauma and violence. There's absolutely no question about that. We know that research teaches us there's an interlink between traumatic experiences and criminal behavior, revealing that offenders present a higher prevalence of post-traumatic stress disorder. We also know that chronic and prolonged exposure to violence may evolve into a dysfunctional routine, perpetuated in both family and community contexts, creating, and this is very important, creating a link between experiences of violence as victims and later experiences of violence as perpetrator. And this is very important to understand. This experience of trauma can lead to someone from the experience as a victim to the experience of perpetrator. Now, this also being said, we have to reflect on, again, this idea that it's not only the personal experience of trauma. It's not only what happened to me. One of the most interesting examples that I've heard on this was, a young child was acting out in school, and there was a school counselor that kept asking him, what is happening with you? What is going on with you? What is going on with you? And as it turns out, it wasn't what this child was going through. It happened to be what his mother was going through, and the challenges that his mother was going through, and the suffering that she was going through. And her suffering was impacting his performance in the classroom. And so what's very fascinating is, instead of asking the question, what's happening with you, there should have been the question, what's happening at home? What's happening with your mother? What's happening to the people in your social networks? This is where we must introduce the concept of what we call in our work, trauma-affected community. That is to say, there are some communities that are disproportionately experienced with trauma. Now, we can talk about the ACE study. Many of us are familiar with adverse childhood experiences, the rate of trauma before the age of 18. We must also, at the same time, acknowledge that the ACE study was done for a predominantly white population. So whenever we look at these 10 things that the ACE test is screening for when we're screening for trauma, there are also things that test doesn't pick up. The city of Philadelphia did an ACE test in which they included what they called expanded ACEs that included things like, have you seen someone die as a result of gun violence? That question is never asked now in the first ACE study, but in this, with these additional ACEs that they added that were more suited to urban environments, they found that there were 13% more respondents that only had these urban ACEs. They didn't even have any of the 10 that usually we screen for predominantly white populations. We also know that this disproportionate experiences of even the ACEs that we screen for, that it is extremely disproportionate in these in many of our urban communities. Just for example, the ACE study, we know if you have a score of 4 or higher, this means that you're at serious risk for an adverse impact on adult health and behavior. It only goes from 0 to 10. According nationally, the average is 14% of Americans have a score of 4 or higher in terms of their rate of trauma before the age of 18. We did a pilot study here in our community, the Hill District, predominantly Black community here in the city of Pittsburgh. And in that pilot study, we found that 61% of respondents had a score of 4 or higher. That's compared to 14% of Americans. Whenever we really look at this, we have to say it's not only that this trauma is so widespread, it's not only the personal experience of trauma, but it's also the collective experience of trauma. That means that it's not, that you see in our community, not everybody's lost a son to gun violence, but everybody knows somebody who has. Not everybody's been evicted, but everybody knows somebody who has. Not everybody has a relative incarcerated, but everybody knows someone who has. That's no gross exaggeration. This prevalence of trauma leads to the concept that we refer to as trauma-affected community. And here is where we have to examine the role that conditions play in fostering trauma. It's certainly, we understand that there are certain conditions, there are certain community conditions that foster and proliferate trauma. With this, we understand trauma-affected community. We're saying that in this particular context, trauma is so widespread and so prevalent that there's a particular worldview that results, that emerges as a result of that multi-generational complex trauma. Now, for many of our urban communities, we have to understand that trauma doesn't just go back one generation. In particular, I'll speak in my own community, being a predominantly Black community, African-American community. We understand that the trauma here in this community begins with the Middle Passage. Trauma here in this community begins with the institution of slavery, which incidentally was extraordinarily brutal. This institution of slavery that was defined by violence, this institution of slavery that was immense trauma that happened over hundreds of years. And so it shapes cultural attitudes. It shapes the character of relationships. It shapes ideas around the world, paradigms, worldviews. So this becomes very important when we understand how historical trauma, going back to these origins that ultimately are rooted in these immensely violent and traumatic experiences, begin now to flow seamlessly into communities that still are racked by trauma and violence in our community. So we understand statistically that that sometimes when people have the indirect experience of trauma, that can affect them even more than the direct experience of trauma. That means that what happens in the community absolutely matters. We have also at the same time to understand that there is such a thing as racial trauma, or what we might call race-based traumatic stress. This really means that there are certain people groups that when particular traumas happen, they affect the entire people group in very severe ways. So whenever we watch the murder of George Floyd over the summer, even though that did not happen in our respective cities, it affected life in our respective cities. Even though our children didn't see it happen personally, they had nightmares about it and they struggled with it and they spoke about it, because these particular kinds of racially motivated events or these particular kinds of racial trauma affect whole people groups. Now, we mustn't also neglect the reality of what we call allostatic load. Councilmember Brown, she's talking about what I heard you speaking about is all of the challenges, the burden, the economic burden that really are on people. Whenever we understand this concept of allostatic load, that there's a particular load that people in poverty bear day in and day out, not knowing where the next meal is coming from, not knowing if we're going to be able to pay next month's rent, especially now with COVID and the economic impact therefrom. So this idea of the allostatic load and what we know from it is that the effect that it can have on people is absolutely the same over time as someone going through a pretty severe traumatic event. So all of this really leads us to question not only the personal experience of trauma and how that feeds into violence, citing the research that teaches us this to be the case, but also to understand that there are particular conditions in community that foster and proliferate violence because they perpetuate trauma on a community level. With this being understood, we need then, as communities, I would argue, to redefine how we understand development in our community. That means that just as we are about the work of these immediate and short-term responses to violence, we have also at the same time take a long-term commitment to a particular kind of development in community. And may I say here, when we talk about community development, we have to think about this community development in the context of this trauma-informed, trauma-affected community. This understanding that it's not just building things and it's not just creating jobs. Even if we create opportunity, which has to happen, we all know this, we have also at the same time to reckon with the reality that trauma can affect health to the point that people are unable to sustain that opportunity. So here in our work, we talk not only about creating opportunity, but we talk about people who are healthy enough to sustain opportunity. We need these particular long-term commitment to interventions that really help us understand the goal of community development being community well-being. For us, we define this as trauma-informed community development. Trauma-informed community development. That means that not only is it about the end, but it's also about a process that facilitates healing on a community level that's desperately needed. This process of trauma-informed community development is really meant to help us go from trauma-affected community to resilient, healing, and healthy community. And really understanding how we are doing that and what is the measure of our impact in that regard. Trauma-informed community development, whenever we think about this, we have also to understand that it is going to be the people of these communities that spearhead this kind of long-term interventions. And yes, it is a long-term intervention. This is a long game. This is where we sit back and we say it's not about days or weeks or months, but it's going really to be about years. What does really this look like, these long-term interventions? We know that community members are going to be the core of these interventions. This is where we look at community organizing. We see there's a value to community organizing. And yet at the same time, very often it is the case that community organizers are simply trying to align people around political objectives. There's more that organizers can do in the communities in these particular conditions. We have what we call behavioral health community organizers. And these behavioral health community organizers are community members who are really taken and trained how to facilitate long-term strategic community interventions. We call them micro-community interventions. And here's what this means. This means with limited time and limited resources, we can't put this blanket trillion-dollar investment across the entire community. At the same time, if we have a particular analysis and understanding of where we can have an impact that has the most significant ripple through that neighborhood, we can then strategically target that area and facilitate an intervention that actually has an impact that goes beyond a specific geographic location. So here's what I mean by this. We have behavioral health community organizers who are trained to facilitate one-year interventions in one particular corner or area or block of a community. Understanding and engaging this particular area, block, the community, we have to also understand how to leverage the social networks that are already in this community. That is to say, there are opinion leaders in the community. And one of the things we know about social networks is that they are extraordinarily valid. That is to say, who the opinion leaders are today in communities, statistically, we know, according to research, that 5 years from now, those opinion leaders will in all likelihood still be the same. Lest they die, move away, and obviously new opinion leaders will emerge. We also understand that there are opinion leaders across various demographics. Someone might be opinion leader among senior citizens, while another might be an opinion leader among youth. Understanding how to recognize, identify, and leverage opinion leaders as part of a broader effort of revitalization that helps us move towards resilient, healing, and healthy community is a particular work of these what we call behavioral health community organizers. We also have to understand how to recognize risk and protective factors in the community. These behavioral health community organizers can really be about this work. How we can work with residents to help identify risk and protective factors and minimize those risk factors while at the same time advancing and enhancing those protective factors. All of this can help us lead to increased social connectivity. We can understand that we can certainly increase the amount of knowledge in the community while at the same time respecting and leveraging the deep wisdom that has emerged from this multi-generational complex trauma in our community. There's so much certainly more I could say, but in my final minute here, I would just like to also encourage us to understand that it's not simply about the end objective. It is also about the process. Whenever we think about helping move our communities from trauma-affected community to resilient, healing, and healthy community, we must pay attention to the process that we outline, because the process itself facilitates and fosters healing, or the process itself reinforces violence in our community because it proliferates violence in our community. The process that we have to lay out is one that certainly is trauma informed. We have to lay out a process that is most certainly inclusive. We have to lay out a process that helps identify small benchmarks along the way so that we can celebrate success and understand when our communities are moving toward resilient, healing, and healthy community. And we have to develop a process that allows us to create a new narrative around communities that in many instances have been given a narrative that has been imposed on them that contradicts the true character of who they really are. Forgive me if I did not speak to the issue or task at hand, but it is a great honor to be with you. I'm so inspired by the work that I see you're doing. I am eager to learn from you, and at this particular time, Councilmember Brown, I would like to turn it back over to you.
Thank you so much. I want to turn it over to my colleagues for questions, but first, if you could give us a sense of how many BHCOs are working in the community at a time, so that we have a sense of kind of scale in the Hill District, that would be great. And then I want to give my colleagues chances to jump in and also ask questions. I thank you for the powerful presentation.
Oh, I'm deeply honored. We have, I would argue that if you had two, depending of course on the size of the neighborhood, I guess this would also be the determining factor. In our neighborhood, which is, we have a population of about between 12 and 15,000, depending on how you count. If we have two behavioral health community organizers that are working, let me say, funded to do this work, we then can also supplement them by having volunteer, certainly behavioral health community organizers. Let me also say that it's not, we can also expand roles. For example, in our work, we do have trauma responders. This is people from the community that we recruit, and we train for a period of about 40 hours to respond and administer psychological first aid in the aftermath of gun violence as a result of homicides as a result of gun violence. We also have community health deputies that we've trained in epidemiological protocols to help combat the spread of COVID-19, and are now working to build vaccine confidence and hopefully to facilitate vaccine distribution. So with this, we say if we have two behavioral health community organizers, which may have more refined skill and more consistent training, we can actually supplement them by a small army of volunteers that are trained in various roles to include behavioral health community organizing to help further their work.
Thank you. That's very helpful. And your description also illustrates the responsiveness on the ground of the work. Thank you.
Thank you.
Any other questions or thoughts from colleagues? Councilmember Phil.
Thank you, Reverend Abernathy, for your amazing presentation. It's really an honor to meet you virtually. Thank you for joining this body this evening. earlier this afternoon, I participated on a panel discussion that was held by one of our law firms in town. And the purpose of the panel discussion was to really talk about this idea of corporate social responsibility and what does it look like for corporations to really be true participants in the social justice movement. We have a saying here in Columbus. It's called the Columbus Way, and it really encapsulates this notion of public-private partnership. And I believe that there are many people in our business community that are struggling with how they can be supporters, participants of this what we're trying to address here in Columbus. And as you really dig in deep in your presentation and talk about this idea around behavioral health community organization, what do you see the role of the corporate business community in making sure that it's successful?
Councilmember, that's a wonderful question. I will tell you that certainly I believe that corporations have a strong role to play in this. I will say that probably the most profound role we have with a corporation in this work is with one of our healthcare corporations here locally, UPMC, and we've been working with UPMC for some time. But one of the things that I'd like to highlight here is really them understanding really the value of this, them understanding really the value of really taking people, building people up, because this is what we have to do. Sometimes whenever we talk about outside involvement, it can be it can be, even with good intention, it can be oppressive. We have to think of corporate partnership in a way that enhances community voice. This has to be one of the key characteristics, corporate partnership that enhances community voice. So whenever we think about, needless to say, corporations can certainly invest, but we don't want them simply to invest. There's more they can do. UPMC being a tremendous partner, understanding the challenges certainly around COVID, we partnered with them to revive something that happened here in the Hill District in the 1960s called Freedom House, which actually was the prototype for EMTs as we know it today. It was a time when African Americans were not receiving proper emergency medical care. And so this concept was, can we take people from the community and train them in emergency medicine to respond? They were so successful, it was adopted by the city of Pittsburgh and became the prototype for EMTs as we know it today, ambulances. Partnering, we talked about UPMC, can we revive this concept of Freedom House? And the answer was we absolutely could. So here's what we have. We have right now, we know that we need EMTs, for example. We know that we need EMTs who are able to respond to emergency situations in our community. We also know it takes a lot to train an EMT. And we know that many of the people in our community don't have the resources or opportunity to do that. So what UPMC has done is that they have made a financial commitment to these candidates who are in the Freedom House, not only talking about the stipend that they get, but also talking about how they can ensure that each of these candidates is going to they're going to be cushioned with the best corporate resources possible. We're talking about employee assistance programs that are usually only used to deal with the issues that we have with employees, to help support employees, leveraging the power of those resources in these particular candidates to help them really be successful. Investing in their training, certainly, investing in their testing, certainly, making sure that they have their own medical bag, their own tablet, and seeing this demonstrates, and at the end of it, making a commitment to, at the very least, give each of these graduates an interview with the hopes that they will be able to hire the vast majority of them. I think this is a very powerful example of what corporations can do, because yes, we do need money, and yet giving money is a very easy thing to do. All of these opportunities that corporations create, we need to have them heavily invested in these communities in a trauma-informed way so that they can be personally involved in pipelines that really raise people up, build a sense of community, foster hope in our community, and also guarantee a chance for those who are coming through this, hopefully further diversifying their corporate ranks in our city.
Yeah, I absolutely, I wholeheartedly agree. And, the struggle, I think that we would hear is, well, one, why does this matter? Why should I care? Right? I'm a corporation. So why does this matter? To my bottom line. It just makes good business sense, right? And you want to obviously be on the right side of history. But I think the other pushback that we receive when you begin to talk about truly tackling violence in a systemic way is that people are growing impatient, right? They are so connected to the outcome, as well as they should, right? Because they don't want violence in their communities. And so how do we, as legislators, continue to elevate the need for a process, right? That is genuine and informed in such a way that brings about the results that we're talking about today.
So, Councilmember, this is really a powerful point. I have a colleague who, and she who is white, who has a strong background in trauma-informed care, who says adamantly that that the impatience that's often experienced in, for example, corporate communities is one of the most stark examples or manifestations of white supremacy. Sometimes we know in the community, like one gentleman told me once, we didn't get into this situation overnight. We're not getting out of this situation overnight. We know that we have to think long term, and we have to be about the work of strategic planning. And sometimes when we're having these conversations in these particular circles, like for example, corporate circles, and they're really trying to put on us that we need, and I understand now people are dying in the streets. We understand urgency on a personal level, and yet at the same time, we have to understand that when there's sort of these systematic pressures, these systematic timelines that are imposed on us, they very often are to the benefit of the one imposing them, as opposed to the benefit of the community. And I think we have to reframe these conversations. And really, I mean, that's quite an extreme statement. She's adamant about that. But really, that these timelines are an expression, they're a manifestation of white supremacy, because they always benefit those kind of power structures. And I think if we can help people see that, it can help perhaps cut through some of the challenges that creates. Certainly, there's no easy answer on any of this.
Truly appreciate that thought, Reverend Abernathy. Thank you, Councilmember Brown.
Thank you so much, Council Member. Are there other questions from my colleagues? Well, I really appreciate your generosity of time today. And we, as you know, are going to continue to learn. We've had a learning journey about Focus Pittsburgh already, and we're going to continue to. And she cries when I talk. Like literally, she's quiet the whole time that the rest of you all are talking. And then I talk, and she's like, "Mommy, be quiet." But we're going to continue to learn from the good work that you're doing. And I just the perspective that you provided here today from successful work in Pittsburgh, but just also, from your heart and your wisdom, speaking of community wisdom, is invaluable. So thank you so much.
Councilman, thank you.
Yeah, yep. So we are now at the portion of the hearing where the first of all, I want to thank all the presenters. Thank you again to all of them. But we are at the portion of the hearing where Saunders Company will take over to walk us through an audience engagement exercise, so we can really hear from everyone participating at home. I thought that these have been great additions to these hearings, and I'm always impressed by what the Saunders Company brings to the table. So, Gail, over to you.
Thank you so much, Chair Brown, and the little one as well. So thank you so much, Council President Hardin, Councilmember Remy, Councilmember Favor. Thank you so much for the opportunity. Tonight, we're going to walk you through an exercise to really get you engaged in additional information in addition to the survey that many of you have taken. And so first and foremost, we want you to get out your phone or either go to another browser on your computer and go to www.menti.com. Again, that's menti.com. And once you get there, you're going to be asked for a code. And that code tonight is 6406973. And Miss Angie, if you'd be willing to get Miss Cheryl her presentation up, and we'll begin our work together. And so we'll say it one more time. That is menti.com, and the code is 6406973. And for all of you who are on Facebook, and we see you, all of you on YouTube as well, this is your opportunity to give your voice as well. And so please join us on the menti.com. Tonight, our first question is, how can the City of Columbus address violence in our communities? We've heard such a powerful programming out of Pittsburgh. You've heard what the City of Columbus is doing and the proposal that we have. So think about that, and in addition to your own ideas. And we'd like for you to enter those in Menti. That's menti.com, and the code is 6406973. Again, for those of you who are watching on YouTube and those who are participating on Facebook, and I know we've had a few technical challenges on Facebook, but thank you for staying with us there. Please also participate. And of course, those of you who are attending tonight as well. So please, think kinship programming. Thank you. Any other ideas you have about addressing violence in our communities? This is your opportunity to share what's on your mind, give us some additional ideas, invest in communities and in people. Thank you for that. Those of you on YouTube, there you're coming. Thank you. Increasing pro-social activities for youth, including activities that build resiliency. We heard that this evening. Continue these types of conversations and elicit corporate partners. You heard that question from Councilmember Favor and the importance of getting them engaged in meaningful and deliberate ways. Find the small organizations and the community leaders doing this work and invest in them. Remove barriers to accessing city dollars. So think about how we can make it easier for people to access dollars. Investing in family unit. We have about 30 more seconds. So please keep these coming. More job training and community investment in our young people. A lot of information about the youth employment. Consistency in youth employment, not those episodic opportunities that we give our youth in employment. It needs to be sustainable and consistent. Give people jobs. Qualitative life on life mentoring support. All of these are wonderful ideas. More community-based programming. We have about 10 more seconds. If you have any other ideas that you'd like to get in, sure, we might leave it up a little longer we see where people are beginning to respond a little more. Hold the police accountable. Fund the small grassroots organizations. More school to work programs and get the schools involved. And we saw some of that in some of the chat information that's been coming through in some of the chat comments. More parenting support structures. Community organizing. That was talked about tonight in our presentations. Advocate for higher Medicaid reimbursement so the social workers can really get paid and really help support those in need. Cultivating community-based nonprofits and funding those that already exist. So I think we're getting to see some of the same. So thank you for that. Thank you. If we can go to the next question. Our next question really wants you to really think about how and where city council members should invest these dollars as they're making their budget decisions. So this question is, the City of Columbus should invest in what to address violence prevention? And this is your opportunity to think about what we heard tonight, moving from trauma-affected communities to resiliency and rebuilding healthy communities, making sure that we are really thinking about how we can do that. So think about that as you think about what should Columbus City Council invest in for violence, to address violence prevention. Domestic violence prevention. Thank you. Mental health resources. Thank you. Anything that you can think of. Food access programs, affordable housing in safe neighborhoods. Affordable housing, that comes up frequently in these conversations because we know earlier we talked about the social determinants of health and how all of that plays a role in community violence. And that is absolutely something for us to think through. Evidence-based mental health treatment. After school youth programming, talking about the youth again, social services, school resources, and not the officers, but professionals in those professions. Thank you. We have about 30 more seconds. Any other thoughts? Any other thoughts? Let's see if we see anything differently coming in. Invest in people doing the work already. There are many people in our communities who have boots on the ground. And so how do we invest in the work that they're doing? Thank you. Thank you very much. And so this needs more touch points between resources and people, not just safety of law enforcement. Something like 311, but in person. Thank you. And so mentorship, they still keep coming in, so we'll let them keep coming in. The Healthy Neighborhoods, Healthy Families program and organization. Recreational programming, more of that. Stricter sentencing for those who commit violent crimes. Housing First services. So great energy around this and quite a few ideas. Stabilizing families, and there's that has a lot packed in it when we talk about stabilizing families. Thank you so much. And that collaboration with community health organizations and community-based organizations so that we're not all working in silos. And that's it. Thank you so much, Cheryl. If we can go to the next question. I want you to think about some of the barriers to prevent where we want to go in this space. Language access, state law, failure to understand the root causes. And we've heard quite a bit about it's not just law enforcement, but it's the entire system of justice. And so we have to think about that holistically. When you mention state law, that's part of that. Funding, unions, and bias. Reluctance to change the systems and policies and laws that are oppressive or harmful. Distrust caused by the lack of police accountability, and that was a topic last night, accountability. Failure of our education system. Judgment and shame-based approaches. That's something that would not come up, so thank you for that. That's new to our conversation. Thank you for adding that. Thank you all for all of these responses. Disproportionate investment on law enforcement interventions. Not taking domestic violence seriously. Politics over and above understanding others' lived experiences. Implicit and explicit racism. Not trusting the systems. 30 more seconds. So your other thoughts, please keep them coming and get them in. Trust in local government. Families focus on financial survival and multiple other situations that they're dealing with that it makes it hard. So we need to think about that as well. What are families dealing with on a daily basis, and how can we ease some of those barriers? Thank you. Thank you. And so we'll go to our next question. And this question, it really is an opportunity for you to really think outside of the box, to really think about that powerful conversation we've had from Reverend Abernathy, think about what we heard from the health department. And so we really want to think, what is your vision for preventing violence in the city of Columbus? If you had an open book and an open pocketbook, we know the Columbus City Council has some parameters around that, but this is a vision. Think big in terms of what you would like to see the city of Columbus do to prevent violence in our community. And just think about that trauma-affected community, going from that to really building communities that are resilient, that are healthy, that are long-term and sustainable. Really think about what we can do in this city. This is an opportunity for us to really move the needle and really get to the heart of this of the matter. So give us your ideas. Supporting healthy families and safe communities, the collaboration that we talked about earlier, the funding for mental health and diversion programs, transparency, family center, where every member of the family can get what they need to thrive in one space, one-stop shop, safe spaces and personalized content for men, women, couples, and teens, a hub in prioritized areas that includes that one-stop shop for various needs under one roof, investment in schools and mental health programs, helping better incorporate our new Americans into our community, police defunded and those funds redirected to nonviolent de-escalation, violent prevention, instead of that type of response in terms of only a law enforcement response. Talked about the family center. Educators have access to mental health training and trauma-informed care training. Connecting people. Conflict mediation. Conflict mediators in all communities. It's very similar to what we heard in the presentation. Those on the ground influencers at every level who can be trained in multiple disciplines to support our medical and other professionals. Investment in schools. I think lower cost of living, access to food, and mentorship. Building beloved community and historic commitment to nonviolence and wars. And so I think that, do you see new ones coming in, Cheryl, or you think we've got to the end of it? Okay. Well, that includes that portion of our work together. I will say and remind you that there is a survey. Columbus City Council members want to continue to get your insights and are really encouraging this community to take the survey. It's a 16-question survey. It really does cover all of the topics and themes that they've talked about over the course of these town halls. And you can find that at columbus.gov/reimagine safety. And so if you could, you can go to that and take that survey. You can also get to the survey by going to the Columbus City Council website and go to Reimagine Safety, the section on there. You can also get to it there. We want to thank you for your participation tonight. If you have any other comments or any other questions, or if you come up with other ideas as you talk with one another or talk to other members of your tribe, please send us any of those comments to reimaginesafety@columbus.gov, and that's reimaginesafety@columbus.gov. We thank you for your time this evening. Thank you for your engagement and participating. Chair Brown, I will turn it back over to you.
Thank you so much, Gail. I really, really appreciate that functionality. There are little things that in the pandemic going virtual have actually added to our experiences of being in virtual community, and Menti is one of them. I appreciate so much you leading us through that. And with that, I want to underscore the call to participate in the virtual survey. but we've also reached the public testimony portion of the agenda. So I'll call your name, and then council staff will unmute each speaker as I've called their name, and you will have 3 minutes to speak. So we will start with Doug Wolf.
Council President Pro Tem Brown, thank you for hosting this important discussion and for your commitment to our great city and its people. Council President Harden, members of City Council, Reverend Abernathy, Mr. Johnson, and Assistant Attorney Furby, thank you for your leadership. I'm Doug Wolf, Chief Executive Officer of Boys and Girls Clubs of Central Ohio. What we are facing now is not a new issue. Since 1965, homicide has been among the leading causes of death. In 1979, U.S. Surgeon General Julius Richmond's groundbreaking report, Healthy People, identified violence as a public health priority. During the 1980s, the risk of homicide reached epidemic proportions, disproportionately affecting minority groups and youth. 2020 was a year in which racism was finally and properly declared a public health crisis, and a pandemic necessitated physical distancing from our family and friends. 2020 was also a particularly devastating and violent year, especially for our youth. The average age of those being victimized by and those perpetrating violence decreased. 22 young people under the age of 18 died by homicide. 14 children were identified as homicide suspects. Our young people are this community's most valuable asset. Yet there are a set of circumstances shaped by a long history of both intention and negligence that surround many of them that lead to destructive outcomes. Violence is in fact a public health crisis, one requiring a public health response. The most effective public health efforts are those backed by a set of select evidence-based interventions. Deep investment in a few proven interventions sharpens our focus, allows us to connect and coordinate services, and moves us to action leading to near-term and sustained outcomes. The Centers for Disease Control identifies strengthening youth skills and connecting youth to caring adults and activities as among the most effective interventions for violence prevention. This is the core of our work at Boys and Girls Clubs of Central Ohio, and it works. 94% of our club members expect to graduate. 93% state they have at least one staff member they could go to for help in a crisis, and 54% of club alumni say the clubs saved their life. We must invest deeply in public health interventions that work. We must invest deeply in our young people. We must invest deeply in Boys and Girls Clubs. With our support, they can and do achieve great things. They become our leaders. They themselves become catalysts for long-standing change. And I'm hopeful every time I step into a club because I see the faces and families that are transcending the potential for destructive outcomes. But I'm also fearful for their safety when they leave our doors and embrace. We as a community need to embrace them now. It takes a village. I'll end with a statement from Scott Thompson, former chief of the Camden Police Department in New Jersey. He states, "I would trade 10 cops for a new Boys and Girls Club." I, for one, wholeheartedly endorse this. Thank you.
Thank you so much, Mr. Wolf. Thank you for the work that Boys and Girls Clubs does throughout our city. Our next speaker is Brian Weaver. Mr. Weaver, are you on the line?
I'm sorry, council member, I do not have Brian Weaver listed this evening.
Okay.
He is not on the line.
All righty. Next then is Tammy Milbury. Miss Milbury, hope I'm saying it, maybe Milbury.
Milbury, that's correct. Can you hear me?
Yes, we can. Please proceed. You have.
Hi, how are you doing? I want to take this time to say thank you for your interest in our community and taking the time to hold these meetings. I firmly believe that it's going to take a village to solve the issues that we're having here in Columbus, Ohio at the present time. I'm a retired Columbus City school teacher, and I witnessed a change in our students within the 30 years I was teaching. and the breakdown of the family. And I believe that we have to figure out some type of way to rebuild the family unit. And so we have to address the problem as a whole, not as parts. And I think sometimes that's where we fail. We're addressing one part of the problem and not really going to the root of the problem. So, but I do believe that we can do it. And it's going to take a village to do it. So thank you for your time.
Thank you so much, Ms. Milbury. I think that's right, that we've got to address things holistically. And I want to thank you, a career of 30 years in teaching. I mean, you made a career of building resiliency in our communities. So thank you for that, and for your personal investment through your career in strengthening our communities. Thank you for joining us tonight. Our next speaker is Vicki Thompson-Sandy. Ms. Thompson-Sandy, are you on the line?
I am. Thank
Yes,
you for having me this evening, council members. My name is Vicki Thompson-Sandy. I'm the president and CEO at the Buckeye Ranch. And let me start by bringing us some context. According to the 2017 CDC data, violent and premature deaths have increased for youth ages 10 to 24 since around 2014. This includes suicide and homicide deaths, which are respectively the second and third leading cause of death for this age group. Data from the National Youth Risk Behavior Survey provides additional context. In 2019, nearly 22% of youth reported being in a physical altercation in the 12 months preceding the survey, and 13% reported carrying a weapon up to 30 days before the survey. These are various contributing factors to youth violence, including trauma, lack of resources, social determinants of health, and mental health. The Buckeye Ranch remains committed to serving the needs of youth and families. Our programs serve youth impacted by violence, whether they are victims, offenders, or both. One of our treatment models, multi-systemic therapy, has a specific focus on delinquency. The Buckeye Ranch uses this evidence-based model because scientifically proven that families and communities are essential partners and collaborators in treatment. MST has also found that over 50 years of research that delinquency is determined by multiple risk factors in a youth's life, including low monitoring and high conflict in the family setting, association with law-breaking peers, low school achievement and dropping out, low supports and high rates of people moving in and out of the community, and low verbal and social skills of youth. We have seen youth positively impacted by MST and other treatment programs, but our staff have also observed and experienced multiple barriers to address youth's involvement in community violence. The families that we work with struggle to find affordable housing, increasing their own need to move often, and this makes it difficult to build, sustain, and access community supports. Many of our families also live in food deserts and don't have access to affordable and nutritious food. It is very difficult for these families to prioritize family therapy when their struggle is really about meeting their own basic needs. Our children and youth also lack access to pro-social options outside of the school, and many of our children and youth do not qualify for activities through the school system due to their own behavioral issues or low grades that they have not yet been lifted to be able to play sports. Our schools lack resources to adequately support the youth's complex needs. And we find that the caregivers often work non-traditional schedules for work to meet the basic needs of their financial needs for their family. The youth that we serve The youth that we are serving is without access to supervision or the ability to meet more positive peers through structured activities if they cannot walk or take the bus safely to these pro-social activities like Mr. Wolf talked about at the Boys and Girls Club. So we believe in the work that we do for children, youth, and families in our community, but we also are aware at the Buckeye Ranch that our communities need more resources to better address the risk factors across multiple systems that impact youth and families to successfully prevent violence. Thank you for hearing me tonight.
Thank you. Thank you so much. And thank you for the work of Buckeye Ranch, and as is evident in your testimony, how important it is to our youth and families. Our next speaker is Ebion Farah. Is Ebion Farah on the line? I hope I'm saying your name correctly.
Yes, can you hear me?
Yes, we can. Thank you, Ms. Farah.
Okay. Yeah, thank you, council members, for this important discussion on preventing violence. But I think it's important to mention family violence. I'm currently a fourth-year student at Ohio State, and I intern at CRIS's Victims of Crime Advocacy Unit. If you're unfamiliar with CRIS, it's a community-based refugee and immigration services center here in Columbus. Our work mainly surrounds domestic violence cases after an individual has been victimized. Currently in Ohio, 1 in 3 women and 1 in 4 men have experienced intimate partner violence. Intimate partner violence accounts for about 15% of all violent crimes. About 72 of all murder-suicides involve domestic violence. Of that 72%, about 94% of these victims are female. These numbers exponentially grow within immigrant communities, especially during the COVID epidemic. I would like for City Council in their prevention to allocate funding in preventative programs focused on domestic violence. Some suggestions for those programs are to develop and implement educational activities on a local level with youth, women, and immigrants. Bringing awareness to youth about risk factors of domestic violence and IPV can help raise awareness and help young people understand what healthy relationships are supposed to look like. It's important to note that CRIS, the VOCA program, and a multitude of victims of crime advocacy programs have received a huge cut in funding this year. Increased funding into organizations that are already doing the groundwork to support vulnerable individuals that face issues like domestic violence is critically needed. Thank you for your time, and please consider my suggestions.
Thank you, Ms. Farah. Thank you for joining us and providing that perspective. And thank you for the work you do with CRIS. Yet another just very important organization here in our city supporting residents. So thank you for the perspective from that angle. And our final public speaker here tonight is Stephen David. Mr. David, are you on the line?
Yes, I am.
Great. Go ahead. You have 3 minutes.
Yeah, thank you. President Pro Tem Brown, President Hardin, members of council. My name is Steve David. I'm a social worker living on the south side of Columbus and Marion Village and a member of the Columbus Safety Collective. Thank you all first for continuing to hold these vital conversations. I first want to speak personally to the experience of witnessing violence take place in my neighborhood, watching the police leave, and the jarring realization that there are no structures in place to make our neighborhood whole afterwards. Following a shooting that happened on my block after police detained a few young men for hours and then left, it was up to me to reach out to the family and try and be a liaison with our neighbors. After I had to intervene in a physical confrontation between a neighbor and intimate partner, no one circles back to have a conversation about safety and healing, and we rely on a court system that delivers neither safety nor justice. And when these incidents happen, even well-resourced and well-connected community members can find ourselves without support. And when we draw the connection to the money spent on law enforcement interventions that fail to support the fabric of our communities, it becomes obvious to me that we need some fundamental shifts in our thinking and our spending. And so while we're having these conversations about violence prevention, I think we also need to be thinking about police violence in the violence we are seeking to interrupt and prevent. You heard hours and hours of testimony during the demilitarizing police hearing last June about Columbus residents brutalized by police during protests over the summer. Yesterday, we learned about a Columbus police officer who was fired for soliciting sex while on duty and has been given his job back following arbitration. And our city is still grieving the deaths of 2 Black men killed by police this past December as we hope for justice, even though we know how this story ends. So I raise this to say that part of violence prevention must involve moving away from police interventions and investing in those that allow us to support, stabilize, and heal with our neighbors. So as I said, I'm here as a member of the Columbus Safety Collective, which, as you know, we have been advocating to City Council to establish a non-police crisis response program. While this may seem like a separate conversation from these that we're having today around upstream violence prevention, the harm reduction approach of moving away from police to the use of appropriate professionals, peer supports, and community mediators should be a cornerstone of addressing violence in our city. And finally, I would be remiss if I didn't take the opportunity today to speak the name of Amber Evans into the space, as this is the second anniversary of her passing today. Amber dedicated so much of her incredible work to establishing restorative justice practices and bringing that needed support for young people in our city. May we continue to honor her legacy by embracing the possibilities of this moment with a bold vision for the future. And as I do have about 25 more seconds, I wanted to thank President Pro Tem Brown for her Instagram post about her baby's witching hour the other day. Is helping me get through these screams from about 6 to 8 p.m. in my own life. Thank you so much for your time today, and appreciate the conversation.
Well, congratulations on making it through. I know it's a day at a time. But I really appreciate you acknowledging the second anniversary of Amber Evans' passing. She's here in this conversation tonight. I will say just personally, and I know others on council feel this way who knew her, I still think about conversations I've had with her. She was a powerful advocate, and it informs the way that I approach justice issues to this day. So thank you for that. I also want to thank you for your overall testimony and just this is the closing of the hearing. You were the last public speaker, but I think for everyone to think about and not to speak for council, but I know that each of us has chaired a different topic of these Reimagining Public Safety hearings, and Council Member Favor and Council President Hardin chaired the crisis response hearings. We don't see these as siloed conversations. Mr. David's testimony about crisis response, harm reduction by getting the right responder to the crisis. Yes, that was technically in a different hearings subject matter, but it is absolutely related to what we're talking about today. The trauma inflicted by law enforcement that Mr. David called out, we should have zero tolerance for it. And we know that trauma does lead to violence, does correlate with violence, does cause violence in communities. And that's why all of these topics must be explored. Accountability. Councilmember Remy and Councilmember Dorans are chairing hearings on accountability and improving the police force. So these three are interrelated, and I think that I can count on some agreement from my colleagues on that. So before I do close out, I want to give a chance for, I want to do a couple thank yous and give a chance for my colleagues to say anything. I made it to the end, despite Maribel's attempts a couple times to derail me. I want to thank our guest speakers and all of you for being a little bit patient with me. I want to thank CTV for broadcasting these. I want to thank our council staff and Saunders Company for helping to set up 6 of these hearings that have been engaging, we hope, for residents, and have allowed council members continued ways to understand and create a vision for public safety. Most of all, I'd like to thank the residents who participated this evening and at all of the town halls. Our final one is Tuesday, February 2nd at 5:30, investing in accountability and a better division of police, hosted by Council Member Emmanuel Remy. So again, before I close out, is there anything that any of the other council members on the line want to make sure we end with? All right. Okay, well, thank you all, and see you on the 2nd. And don't forget, those listening and watching, please take that online survey that the Saunders Company that Gail discussed during the mentee.com portion. So that concludes our town hall, and thank you to everyone.